6:46 is the time. Good morning, and Dr. Peter Abadir is our guest this morning, and we're talking diabetes this morning. And of course, you take time every few weeks to come by and visit with us this morning. We appreciate that.
Pleasure to be here. Thank you, Jim.
Now, this morning, your topic is talking about blindness. This is something that lots of times is a result of directly from diabetes, isn't it?
Right. Today, we'll talk about not to lose sight of diabetic eye diseases. And diabetes, as we all know, is a systemic disease. It affects every organ in the body. But one of the most important organs that we have are the eyes. Diabetes affects every part of the eye. It can cause multiple diseases in the eye itself. One of them is cataract, the other is glaucoma. Three main groups, mainly cataract, glaucoma, and diabetic retinopathy. Cataract and glaucoma are less common, but the most serious one that everybody knows about is diabetic retinopathy. Now, why is it important to talk about diabetic retinopathy? Because a person with diabetes has 25 more chances of getting blind than a person without diabetes. Statistics say that 12% of all new people that have blindness in the United States, it's due to diabetes. And it's something that we can prevent. So I brought with me the eye model to show different parts of the eye and to put it in perspective. This is our eye model, and it shows first, this is the lens. Clouding of the lens happens because of cataract, twice as normal with diabetes. So when this part of the eye gets cloudy, this is we call cataract, and it happens because of diabetes. Second part is this fluid part. When there's more buildup of the fluid in this part of the eye, this is what we call glaucoma, and it also happens because of diabetes. Those are the first two diseases in the eye that happens because of diabetes. But the most important one, and the one that I want to concentrate on, is diabetic retinopathy. In this part of the eye, this is the back of the eye. This is the photosensitive part that we use to see objects. And as you can see here, it has lots of blood vessels, the blue and the red blood vessels. As with any blood vessels, like in the heart, in the kidneys, they start to leak. And when they leak around here, when there's lots of fluid, then a person cannot see through them, which happens with diabetes. How to prevent diabetic eye diseases? First thing that we can do is to be active, to be responsible for the diabetes. Diabetes is a serious disease, but it can be controlled. We can control it. It should not control us. Three numbers that we should know. The first number is hemoglobin A1C. Hemoglobin A1C tells us about how good is diabetes controlled throughout the past 3 months. It should be around 7. So remember, always hemoglobin A1C should be around 7. Second number is blood pressure. Blood pressure needs to be around 120 over 80. Third number is cholesterol. Bad cholesterol needs to be around 70. So those are the first three numbers. One of the most important things that every diabetic needs to do is get a dilated eye exam every year. Dilated eye exam is not just, where you go and check your visual acuity and see if it's working. It's where you have to go to an eye doctor, and they put drops and dilate it and look at the back of the eyes and see if there's any leak or anything.
Right.
Because it's preventable, not preventable totally, but it can reduce the loss of visual acuity.
You can catch it early is what you're trying to say.
Right, right, to prevent the progress of the disease.
Well, Dr. Abadir, we appreciate your information this morning. We're out of time, and we will look to see you here in a couple more weeks.
Thank you very much.
Thank you, Dr. Peter Abadir. Thank you. Stay tuned. Mountain News This Morning continues in just a moment.